Hi everybody, my name is Natalia Rudiak. I'm a city council member here in Pittsburgh. I've been on council for 2 terms. I represent our southernmost neighborhoods in Pittsburgh. So I am probably the least expert person about this issue on this panel and probably in this room. And what I'm about to say probably falls more in the realm of political science more than neuroscience, so maybe that's another kind of intersection we can talk about. But my interest in this issue actually came out of jet lag. I'd come back from vacation and I had seen that there was a 7 a.m. presentation from the Department of Health on a Friday that I decided to attend about, it was actually Ron Borges from the Department of Health from Allegheny County who was doing a presentation on early childhood development, and the ACE study he was talking about the ACE study and basically how he quantified it into economic development dollars for Allegheny County. So I thought, oh, that looks interesting. So I went to that study, and I feel like my entire worldview changed. Because as an elected official, I go to rooms full of hundreds of people who yell at me every day about problems of drugs in their neighborhood, poverty, crime, and oftentimes I say, it's a national issue, it's a state issue. We're trying to work together to find these local solutions and put them into economies of scale, but it's so difficult. And here we were, and here was Dr. Borges saying, you can actually quantify these things. And not only can you quantify, the ACE study that someone's something like 7 times more likely to be, a user of intravenous drugs if they had X number of experiences, but you can actually quantify what that means and how you can actually, this sounds terrible, but save money for a municipality or for a state or for a country long term. I was, at that time, I'd also read a New Yorker article about poverty and stress and how that all came together. Is everybody familiar with the research of the Minneapolis Federal Reserve? No? Highly suggest going there. Just look at Minneapolis Federal Reserve, early education, early childhood. These are economists who have literally quantified this data into economic terms and have literally done papers and research and shown that investing in early childhood actually has more return of investment for any municipality or state than investing in casinos or investing in stadiums or anything like that, and they've been doing a great job on that. So, everything that the Reverend and others have been talking about, I think, requires a public investment, and that requires a political investment. But there's a giant gap between the public investment and the public rate of return. And why is that? I think I'm going to say something that is going to really hurt everybody's brains in this room, no pun intended, but I still think from being on the ground, I don't know if it's elected officials that are amplifying this from their constituencies or sort of the elected officials are stuck in the past, or if it's more the populace, but I do think that so many people still view the institutions that have traditionally cared for very young children as necessary but regrettable aspects of the fact that many women work or choose to do so. And that's the uphill battle that we're facing against. There's a great thing, actually, PC, Pittsburgh Association for the Education of Young Children, great partners in this work, sent along a paper from the Frameworks Institute. You can look it up. It's about framing early childhood development and framing the messaging on that. And this is actually from 2009. I'd love to see an updated aspect of that. But they've done focus groups about public perceptions of early child development and how we actually can frame it. And some of what I'm going to say is around that. All right, presentation. Let me use this. Okay. All right. But a lot of parents in my district know how important it is for their children to have a high quality early education. And thanks to many of the research that you all have done, much of the research that you all have done, that case has been made, but that doesn't make it any easier for parents to find a good school or center, or let alone for the tuition for that. Just a couple stories. I have a couple parents in my district. I won't go into the details, but I have them right in front of me. That I literally have parents who do not take promotions in jobs because then they disqualify for assistance for early childhood. I had a constituent who bought her house within a feeder pattern of a local early childhood education center, so her daughter could attend school there, but the year that her daughter actually was ready to attend school, the school closed because of lack of funding. She had the family applied for Head Start, didn't qualify. The schools that they contacted started out at $700 and they literally couldn't afford them. So the case has been made, but we're lacking public investment to bridge that gap. So I'm going to talk about the landscape in Pittsburgh, the barriers to accessing early childhood programs, what we're doing in Pittsburgh and advocating beyond. This is a map of Pittsburgh, our crazy shaped city. But last year, City Council set aside funds for the Pittsburgh Association of the Education of Young Children to do a needs assessment to understand Pittsburgh families and their needs in relation to the location and affordability of child care centers, which provide most of the high-quality early education programs in Pittsburgh. This map is one finding of that assessment. It shows that so many kids in Pittsburgh can be considered vulnerable due to social factors, their parents' education, access to educational resources, economic factors, and community wealth. And this is important because we can show that the vulnerable kids stand to benefit from these early childhood programs. There are over 15,000 kids in the city of Pittsburgh aged 4 or younger. We know that more than half of those kids' families are earning less than 300% of the federal poverty guidelines. This means that they qualify for state or federal subsidy, like Head Start or pre-K counts, which is a state program, but there simply isn't enough funding of that to go around. Right now, there's about 1,500 3 and 4-year-olds not focusing on or not attending pre-K anywhere in the city. And the Pittsburgh Public Schools program has a waiting list of 400 kids. Why? Because there isn't enough funding. If we had $36 million in the city every year, we can magically solve the problem, at least for 3 and 4-year-olds, because there's a political will. Even though we've had all of this data to show that it starts before the womb, we have the political will for 3 and 4-year-olds, because I still think that we have this idea that from prenatal to 3, that still is this private realm. And that's my personal opinion. The thing is, if we had that magical funding, we would have a capacity problem and a quality problem. So centers and schools would need additional funding to help ramp up new classrooms and hire new staff to accommodate additional students. And we have a rating program in Pennsylvania, but it's voluntary and can be rather expensive to participate in. So we need to provide some funding for these centers to increase their quality and capacity across the board. All right, this is pretty interesting. Again, I keep talking about funding. This is a chart of early childhood funding in Pennsylvania from 2010 to this budget year. It's not like to talk about politics, but it's real. If you look at that jump between 2013 and 2015, that's when a new governor was elected. And I'm actually going to, I meant to put this in the slides. Sorry. Some of you may have seen this before, but I think it's important to point out. I want to make sure I get this right. So this is public spending. My writing is terrible. This is brain development. So we spend more in public spending as the brain becomes more stable, but we're lacking that public investment for when the brain is being most developed. So how do we increase that? So that's my job and your job. But we'll try and work together on this, right? All right. So let's see. Just really quickly, barriers to early education. Again, many parents cannot afford private paid child care. It can cost more a month than a mortgage. Centers and schools are already operating on razor-thin margins, so it can't lower the cost per child. So again, we need to bring more funding into the equation. Okay, so pretty quick overview of what we're doing here. I know in the late 90s, there was the Early Childhood Initiative, which many folks in this room started. It did lead to a quality rating system, but essentially one of the lessons learned was that most families need full-time programs and not part-time programs, and then improving the quality of a program should be a process over time and not an upfront requirement for funding. So moving on to 2013 and 2016, again, what happened in 2013, I was elected in 2010, but what happened in 2013, we got a new mayor. We elected, we didn't just get one, we elected one. We worked, we voted a new mayor in. And this was a big issue that he campaigned on. It really was. So the mayor commissioned a blue ribbon pin on early childhood education, and I have been meeting this year about this as well. So we brought together foundations, advocacy organizations, the public schools, city officials to draft recommendations for improving access to early childhood programs in Pittsburgh. You Google Mayor's Blue Ribbon Panel on Early Education Pittsburgh, you can find it. Again, there were many people in this room that contributed to that, and it had pretty comprehensive recommendations. One of them was that the role of city government was to have the city act as a convener to create a plan for pre-K and ensure that city services are aimed at improving early childhood. One of my focuses has been to make sure that every single department and bureau is focused on how we can focus on the child, and I'll go into what that means. So we did a child care needs assessment. When was that? That was December 2014, and then that went through December 15. So that was passed by the City Council's Women Caucus, which brings another interesting, unsavory political reality into the question. Think about that. It was the Women's Caucus, and led by myself, that brought that into the picture. We also created a council facilities fund. So we set aside $250,000 that was set aside for economic development funds. And we set that aside to create a grant or loan program that would be for independent providers to pay for necessary facilities improvements to increase quality, and so they could actually enter the quality rating system set up by the state. So it would be things, everything from buying books to professional development to installing kid-sized railings for that next level of quality accreditation. And that was, we found out what the needs were from the child care providers from that child care needs assessment. And so what I also did is I passed a resolution and budget amendment in December of 2015 for 2016 to create the Office of Early Childhood within the mayor's office. And we had been talking for years about how to really get some kind of universal childhood education program off the ground, but we really had no dedicated staff. It was really my office that was doing a lot of the heavy lifting. And so, we had many other responsibilities, from potholes to vacant lots, et cetera, et cetera. So we, within the Office of Early Childhood, we created the position of Early Childhood Manager to take on those efforts to be the convener, as was recommended by the Mayor's Blue Ribbon Panel. And about, a month ago, 2 months ago, we hired our Early Childhood Manager, who's sitting right here. Hello. So what's next? Well, we need a plan. Right now, again, as I mentioned, there's political will behind expanding pre-K for 3 and 4-year-olds. And look, there are so many cities and states that are talking about doing this, and Pittsburgh is one in that group. We can learn from the lessons of other cities and states. We're not trying to reinvent the wheel, but we are trying to do is convene a group of stakeholders together to create a report to justify and explain why we need a dedicated revenue stream. And then, we're working with our early childhood manager to identify the process by which we'll create the plan for some kind of expanded pre-K in the city of Pittsburgh. And then Tiffany is also creating the guidelines around an administration of the grant program that we have. And then also talking about aligning city services on how we can better serve our child care providers, from helping our EMS team train our childcare providers on CPR to having our firefighters help them come up with their emergency plans. So really leveraging the city's resources to help these providers. So what can we do to advocate? Again, this Frameworks Institute focus brief is really important. One of the things they talk about is using the language of ordinary people to advocate on these issues. Heads, hearts, and minds is one of them. I mean, when you look at all the data that was presented this morning, we're really talking about how the brain architecture forms the heart and the mind of the human being. We need to elect more advocates to office. Particularly more women, and it's a political reality out there. I would love to see political scientists in the room, if there are any, that could actually look at the correlation between what that funding looks like and what in various cities and states, vis-a-vis the breakdown in state legislatures of gender and other factors. Right now, we actually have Pennsylvania is something like 47th in the country for women elected to public office. And we have no women elected to the state legislature from this area. We need things like legislative hearings and special sessions. I know there's an early childhood caucus, right, in the state legislature. It might be interesting. But we need to think about words and how to use them. I mean, what if it's an early childhood caucus, but it's a brain caucus as much as an early childhood caucus. I mean, I'm just throwing this out there. I mean, maybe if we started talking about the development of the brain and the heart, mind, and soul, and taking it into that realm more than saying specifically it's early childhood, maybe that would do more for political advocacy. I'm not sure, but it's just something interesting to talk about. And I would say for everybody in this room, please, keep in touch with your elected officials sincerely. You never know when that next person is going to walk in, when that next elected official is going to get your flyer in the mail and walk into your briefing at 7 a.m. and the world is going to change like mine did. Thank you.
Wow, they were great. And just to think we are here in this county and all of the support and all of the advocacy that's going on right here among us. I'm just going to open up for a few moments because we still have some time to ask questions. Are there any questions? Yes, Paul.
Yeah, great panel, and Aaron, I thought you did a great service by asking us 4 questions. Therefore, I'm going to do you a great service and ask you a question. Your first one was about policy and the need to have more policy about investing early or earlier. You talked about prenatal, et cetera. So the question is, who's doing this right now here? Where are what's the forum for thinking about state, federal, and local policy? And how do we get that going? What do you need? You and Mark and others are taking this pretty far, but out of today, do we form some form of a policy forum where we really look at, and I think to the councilwoman's question, it's also, do we focus on early childhood, or do you focus on girls of childbearing years, or families and what they can do? I think there are a lot of questions to be answered. I know that rambled, but the question is, what's our next step about policy?
Yeah, that's a really good question. I mean, I often feel like, I as even an elected official on a council level on the frontiers of this. I mean, Casey, I want to give a shout out to you, has been really doing a lot of great work advocating, again, for the education of young children. It's in there. On this, and as part of a statewide network. I'm wearing my pre-K for PA pin. That's a statewide campaign for pre-K and PA. But again, that's really a focus on pre-K. And if perhaps there's others in the audience that could better answer this and know the policy landscape. But I do think that there is an opportunity potentially for the data gurus in this room coming together with policymakers in this room to form a different kind of advocacy effort, looking at that prenatal through 4. And let me just also put this out there. Pennsylvania doesn't require actual school-age children to go to school until age 8. So we're like trying to get kindergarten under our belt. You know, doing advocacy efforts. I mean, again, you know, when I say talking about convening legislative hearings and special sessions, I mean, we have to work to find who our advocates are in the state legislature, and I know we have them, but really work to push them on having more hearings and putting out more bills. Even if those bills may not get it out of committee, you know, they'll get traction, they'll get news stories. So we really need to work on that.
More? Okay.
And it's a great question, Bob. We've struggled with this for many years. So I'm Mark Turner, running the services. Hear me now? Is it good? Done? Okay. Well, I'm Mark Turner, running the services for the county. And it's been a real difficult thing in terms of getting organizing, you know, and doing community organizing in our county and I think throughout the state. I mean, we just go out and do it. I've been fortunate to have county executives who have supported what we do. So we prioritize and we get our funding, as Erin said, to invest in, you know, early intervention and early childhood and all that stuff. But I think, you know, folks, I'm looking at Patrick, but, you know, Allies for Children and, you know, organizing advocacy groups to really take a lead. But I think we also really got to go after like the Allegheny Conference and the corporate sector and make the case because it saves them money. It's much better for them because this is their workforce. And if you can deal with childcare and affordable childcare and all that stuff, it really does make a big difference. And, you know, I don't know, you know, as government, we can't do that kind of thing, but, you know, go back to you, Bob, with United Way, you got the corporate folks there, you know, Patrick, you know, and all others around this room to try to get some kind of coalition to really push the issue. It's a no-brainer in my mind, so it's really been frustrating how we can't make progress on this thing. So.
Okay.
While the microphone is moving, I will just say that we're working right now on trying to figure out a long-range plan for at least 3 and 4-year-olds here in the city of Pittsburgh. And I went to the Allegheny Conference on this specific issue about 4 or 5 years ago, and I think the reception that an Allegheny Conference, for people who don't know, is really a collection of you know, our main corporations and businesses here in the city of Pittsburgh, high-level folks. And I went to them, and I kind of, PNC has been very involved, the bank has been very involved in advocating for this issue. But I think we need to create a place for them to plug in. And hopefully with creation of an implementation plan, we'll create slots for them to plug into, because I don't think they necessarily want to create a thing. They need to know where to plug into a thing. So if we actually create a plan for them to be able to plug into or fund or leverage resources towards, I think that's really good.
Thank you. I'm Chris Gork from the University of Pittsburgh Office of Child Development. I think we're leaving out a major component of our society and the way we work to get this information out, and that's the media. And a public awareness campaign that uses what we heard this morning and gets to the general public, I think can get to the legislature then and can do something about policy, and at the same time to build champions at the city, county, and state, but get them into the legislature that will fight for this. And I do think it's very compelling to use the brain information. We did it many years ago. Some of it's new, a lot of it's new, a lot of it's more respected now because it's gone across disciplines. We really, and I know we have some media, some writers in the room, but we have to get this really out to the general media. Get it on TV tonight, what happened in this room today.
I do have an op-ed on this issue coming out in the next couple weeks.
So, and Chris, I think that's spot on. I think that the opportunity to create a campaign, a media campaign potentially, but a campaign that actually empowers people to take action. Because I think if we look at the panel and what it represents, right, it's essentially a panel that's talking about prevention. How do we deal with the health policy issues and make sure that kids have access in the early years? How do we deal with the programs that get to people and serve them before the need arises, and the value that in early childhood is the best example of that. And trying to figure out how to take it directly to the public and demonstrate to the policymakers that this is in fact not only something that makes sense academically and intellectually, but it makes sense, as the councilwoman was saying, in the hearts and minds of the people that they serve. So media as an effort, but really ultimately posing this to the public in a way that they can actually take action.
I think a lot of the ideas here have been wonderful, and I want to propose a very easy one for people who are in the institutions. So right now, I'm sure there are a lot of PIs here. If one of your graduate students were to have a child and wanted to put that child in the center, the development center at the University of Pittsburgh, for example, there would be a 3-year waiting list. There would be a sliding scale that would amount to a reduction of $100 out of $1,300 for a student who makes $27,000 a year. So I think it's nice for us to think that North Hills has a problem, or Braddock has a problem, and we need to deal with this in a really big way, and I think that that's super important. But I think that the universities have to be the example, and if you can't look around and see that your institution is being an example for what the world needs to look, then I think that that's the easy first step. And then there are a bunch of other steps that I think people said that I also agree with. But just PIs, I think you have, there's one thing about a graduate student saying I need this, and there's something completely different when a tenured professor says my graduate students need this. This is important.
I'm going to take 2 more because I think I'm on a time schedule. We're done by 12:15.
I'm Mark Rupp. I'm a science writer, freelance science writer at this point. Aaron, I wanted to ask you about this, or maybe Mark can answer it, but I know Allegheny County was an early leader in using kinship placement for foster care, to try to boost that whole focus on the way of taking care of vulnerable children. But what I was thinking about was, that often was happening, anecdotally it seemed to me, with grandmothers, because the mothers and other relatives were in situations where they weren't capable of providing the care. As this population continues to age, is there some concern that the next generation of grandmothers will not be capable or available for this kind of kinship care, and what kind of pressures is that going to place
Absolutely.
on the system?
You wanted to respond?
Sure. No, I think it's a great question. But what we've done is we just don't deal with grandmothers. We really look at all relatives, maternal and paternal. So oftentimes it can be brothers or sisters of parents, it can be aunts or uncles, go beyond just, because initially it was really the grandmother had it, but it really has changed over time. And we have a very strong agency, a Second Chance, who does the work for us, and they're very aggressive in supporting and helping and doing all of that to make sure that the relatives get the kind of supports and resources that they need to be successful in this. But that's a good question.
Dr. Chico.
So real quick, Aaron, I want to thank you for bringing up the idea of us thinking prenatally, because we have really strong evidence right now that family stress, family chaos, however we want to label it and define it, is a very strong predictor of a poor pregnancy outcome, whether that's a preterm birth, a neonatal death, a fetal death, or whatever. I can tell you that's not being assessed. And we really haven't talked, when people are pregnant, they go to their doctor. And they're assessing them for diabetes, and they're assessing them for a whole bunch of medical issues, but they're not assessing them for for the degree of family stress. And many times they'll say it's because I don't know what to do whenever I determine that. And I think we need to change that paradigm. We need to make that one of the major things that people are assessed for when they become pregnant or even before they become pregnant, so that, and then educate the people who they're seeing to make sure that they know what resources are out there, that they can do things to get a family help. Doing that, I think ultimately will have a tremendous impact on pregnancy outcomes.
Doesn't really require a response except to say that I totally agree, and I think we are in a position in this community to help to pioneer some of that work. We can, I don't think we need the data to prove it, but I think we will be able to show through some research that RK Mellon's funding that the impact of that kind of stress on those preterm births and birth outcomes. And then I think we can do two things. We can hopefully train a set of OBGYN and medical professionals to ask and know how to assess for those things, and then provide the right supports at that time. I think we have a lot of those supports in this community, and bringing them up one step sooner is prevention for us. And I think, on the analytics side, I think we can also use the administrative data to help physicians to identify that earlier, even without engaging, although I do certainly support engaging, and so that they have a clue earlier on and can help to route to the right services.
Good. One last. Todd?
My name's Todd Willen. I'm a pediatrician and lactation consultant from Kids Plus Pediatrics, and I'm also a board member at Pacey. So this research and this discussion of policymaking is huge and important, and I hope we continue to leverage it. I still think that we're missing the boat on what we can do today. You mentioned two different families, one that got the support and one that didn't, but we see kids in pediatrics, and I would say this nationally, but right in the city, where all these silos still exist and people don't know where we can refer, kids not getting referred into early intervention, kids not getting care that's currently available. So anything that can be done at the city level, state level, to up the game for the people that are seeing kids, which I would say are pediatricians, to better understand what resources are there. And we miss the boat. We put kids on a trajectory that they don't need to be on because we don't get them the help. And the county's about to launch a home visiting kind of public campaign for combined resources. There's other things that can be done, like peer-to-peer support, which we try to do in our facility. But I just feel it's so critical that we stop every day. We let a kid go that whose life could be changed. So anything we could do to improve that would be wonderful.
We could go on and on, but we're going to stop. Let us thank our panel for a wonderful job. And I just want to say again, it takes a village to raise a child. It takes all of us.